1 in 8 women will develop breast cancer in their lifetime. Breast cancer is a leading cause of death in women. However, with early detection, there is a 90% cure rate with breast cancer. Therefore, the American College of Radiology recommends a woman to get a mammogram every year. Originally, 2D mammograms were obtained with a cranial caudal view, as we called it, and a medial lateral view. You had 2 images of the breast, but the 3D images can individually be looked at, and it promotes earlier cancer detection. There's an increased detection rate of 40% with 3D imaging. It's very important for a woman to get an annual mammogram. The earlier breast cancer is detected, the greater your chance of having a cure. If you get a mammogram every year and a change in the mammogram is detected, you may have just a very small breast cancer, which can be treated with a cure. If you prolong your mammogram and you go every 2 years or additional intervals, a small breast cancer can develop and be a larger breast cancer. Then you may have disease that has spread to your axilla, your armpit, or distantly to the bone, and that decreases cure rate.
The procedure itself takes probably less than about 10 minutes. Once the patient is registered, we get them out of the waiting room and we bring them back to the mammogram room. We have a questionnaire that we fill out. If you've had a prior mammogram, it's easier. If it's your first one, we probably ask a lot more questions than you're used to being asked when you come in to have some kind of exam. But the process is quick. We do 4 images and we are processing them, sending them over to the radiologist to read, and the patient is free to go. We try to make the patient experience pleasant. We do have a room that has screens that run nature scenes and sounds, and it's rather comforting. We kind of dim the lights down to where we have an ambience in the room. Most of our patients love it. We do have some that get a little anxious about the moving pictures, and we try to adapt that to each patient individually. We also have some patients that come in that we know are going to have high anxiety and assure them that everything's going to be fine, and we move along in the process real slowly. Patients do not initially need a physician's order to schedule a mammogram here at the hospital. Registration works on that process for them, and if they already have a physician, we will obtain that order from that physician.